Jump cut just to warn everyone. A few of you I know are maybe squickish about needles. I will be talking about an IV catheter. So if you have any kind of squickishness about needles or skin punctures or anything, you might want to skip this update. So apologies for those who saw my photograph earlier and it grossed you out. That was a kind of emergency photo taken in the hospital, and I wasn't quite thinking when I posted it. You can blame the really good medication. So on that note, update follows. Hello everyone, it's pretty rare I do video, so here I am doing video, right? A few people have asked what my overall status is, and as you can tell, I'm alive, if not necessarily at 100%. Beard's grown out remarkably, disturbingly full in the past month-ish of me being in the hospital. But I am relatively okay, all things considered. I am in a bit of an adventurous point in my life right now. As if I needed yet another bit of baggage to carry around in my day-to-day life. I now have to carry an antibiotic pretty much at least for the next month or two while they're treating my bone infection. Yeah, what I had was a staphylococcal infection and of the fifth metatarsal in my foot. Basically, my pinky toe was infected all the way to the bone. And consequently, my pinky toe and part of my foot had to be removed. I have the bandage all on, so you can't really see anything right now. So thank God, because I actually posted, and I apologize to the people who were grossed out by it. I actually posted a photograph without putting a content warning on it a few days ago. Pain is mild to moderate. I can feel it, if that makes any sense. Walking definitely is a different experience now. Physical therapy in the hospital kind of worked with me a little bit on, I don't say relearning, but at least kind of dealing with my foot not being completely present. And at any rate, to the antibiotic, which I call the hand grenade. So this is kind of one of those weird things that you don't really think about until you've dealt with someone who's had one. I have what's called a PICC line, which is a semi-permanent injection or point of injection, like and again, I'll warn people who are needlephobic. There may be needles. I should have probably said that before. We'll edit that in at the beginning so that people who are needlephobic, because I know I have a few, don't get weirded out by this. But basically, they put in a permanent, semi-permanent IV that goes all the way into your chest. The catheter tube goes all the way into your chest. And that's actually kind of a cool thing in the sense that gee, science, I actually am a little bit of a cyborg right now, that I actually have something semi-permanently implanted, and they can access blood and provide me with intravenous drugs this way on a 24/7, theoretically 365 days a year, as long as the actual site here doesn't get infected or the PICC line gets pulled out by an accident or injury. I understand that after a couple of months they will change it out and do something different, but and then I am on these antibiotics, which are injected from this little device into, of course, a twist connector that twists onto that intravenous line. And I change these every 24 hours and throw them away when I'm done. They're disposable. And they're a little pressure capsule, and they provide continuous pressure. The ball provides continuous pressure, which keeps, I guess, the fluid flowing at a particular rate, which I guess in this case is 10 milliliters an hour, at least according to this little pressure regulator. And it's designed to be completely user maintainable in the sense that, you know, they've taught me how to connect these up, and they've given me various things to sanitize the lines and stuff when I change them out. And they will have a home health nurse come once a week and make sure that there isn't any infection setting up in the pick line or anything. And it's kind of weird. So I wanted to give people an update on that. So if you see me now walking around with this funny looking fanny pack, that's why, because this is my constant antibiotic for the next few months, or next few weeks. I don't know, hopefully it doesn't go on more than a month or so, because this sucks. It's a lot less inconvenient than having something hanging off of your genitals, but it still is not an experience I want to repeat anytime soon. So there's that. So that's kind of the state of where I'm at. I'm currently at my girlfriend's house in Aurora, just mostly spending a couple of days here resting, because elevator is a lot more convenient than dealing with stairs. I will probably go home tomorrow. I have been driving home the last couple of nights just to kind of pay attention to things, because it's been months, seems like weeks at least, that I've spent any appreciable time at home, and of course the the cats over there miss me as much as my cat here ignores me, and you know, things. So that's kind of where I'm at. So I'm going to be video posting more, in case you hadn't figured that part out. I keep saying I'm going to try to do this more and more, but I think I'm going to actually pull it off this time. Can't promise once a week. I will try at least 2 to 3 times a week to post something on video on YouTube. So if you want, follow, subscribe, whatever. I don't know where it is depending on your client. On Android it's nowhere. But subscribe, or I will also cross-post to the Book of Face, whatever, so you can see it there. So yeah, we'll probably post more later in the week. So have a good one. Bye, everyone.